I think we should be very direct with our adolescents. And so making comparisons to the safety of marijuana, especially as it pertains to what used to go around when their parents may have been using in the 1960s or 70s, they're really different products now. My name is Dr. Todd Kerensky, and I'm a board-certified internal medicine and addiction medicine physician, and I've completed a fellowship in addiction medicine at Boston Medical Center. I'm the medical director of addiction medicine at South Shore Health, and I also serve as the current president of the Massachusetts Society of Addiction Medicine. Yeah, it was seeing a huge need and working with people in the community, recognizing that this was a disease that was impacting our patients, the families of staff members, and in some cases staff members. And so it was just recognizing a huge need within our community, and I'm really proud of where we've gone over the last several years in terms of caring for these diseases and helping to raise awareness about prevention. THC content in cannabis and other cannabis-containing products or cannabinoids is increasing. For example, THC oils may have up to 70% THC compared to herbal cannabis, which is in the range of about 21% THC. In general, this shift towards products high in THC has contributed to cannabinoid-related harms, including the risk of cannabis use disorder. We know that earlier exposure to cannabinoids may increase one's risk for having health-related problems, especially as it pertains to neurocognitive development, as well as some severe mental illness, including psychosis and schizophrenia. And so early exposure to cannabinoids is a big risk factor, especially as THC or cannabis has become legal in some jurisdictions and has become more popular, especially amongst the adult community as it pertains to medical cannabis and recreational cannabis. This has resulted in the false belief that because it's legal, it must be safe. And this is not true. There is no known safe amount of cannabis that one can consume. And so we need to understand that because it's legal doesn't mean that it's safe, especially for adolescents. I would say more commonly we're seeing young people using marijuana and coming in with mental health related concerns. In some cases, we have seen psychosis or paranoia. And then we also do see some adolescents who have acute symptoms related to intoxication that are not related to psychosis, but more along the lines of nausea, vomiting, which can be associated with withdrawal syndrome from THC in those who use frequently. In the adolescent population especially, we see some decompensation in behavior and psychiatric illness related to psychosis. We have seen some cases where people have had over-ingestion of THC by using edible products. Typically, people have experienced a delayed onset of action as it pertains to edible products, and they may not realize how much they've ingested by the time they start to feel symptoms, which can result in ingesting large quantities of THC, resulting in psychosis, lethargy, and behavioral disturbances, which is most frequently what we see as THC-containing products become more common and legalized, and in some cases more socially acceptable. Inadvertent exposure is certainly a public health concern. As all parents know, because they experience it on a daily basis, children and adolescents have a developing nervous system, and so that developing nervous system really should not be exposed at all to THC or cannabinoid-containing products. We know that there are risks to the developing brain. THC exposure in this adolescent patient population appears to increase the risk, as I've said, for neurocognitive and developmental problems, especially as it relates to frontal lobe development, or the area of the brain related to executive functioning. And it has been associated with severe mental illness, such as thought process disorders, psychosis, and schizophrenia. There is no safe level of cannabis consumption, especially for adolescent populations. And I would also advise parents that there seems to be especially high risk, as I've said earlier, with these higher THC containing products, especially oils that are commonly vaped. or dabbed, and vaping has been associated with a specific lung injury, or VALI, vaping-associated lung injury, which is a particular concern for the adolescent population. And I think really very importantly, as it pertains to educating parents, that new research is showing that THC use does appear to increase the risk of motor vehicle accidents and related harm and death related to those motor vehicle accidents. Parents should be aware of how these products are typically being consumed. You know, their adolescent may be using these electronic cigarettes or vape type combustibles. It may be that the child or adolescent says that they're vaping nicotine, but the parent should be aware that these can be used to vape THC. They should be particularly mindful of changes in behavior or erratic behaviors that are not typical for your child. Sort of being clued into those things and having honest conversations with your children, I think, is really important in terms of educating your children and making sure that you have a pulse on what they're doing and help keep them safe. Yeah, and I would tell kids the same thing I tell their parents. I'm very direct with adolescents about THC and other substances, and we should be honest with them in how we talk about these things. I would tell adolescents that cannabis may be legal for the adult population, but that doesn't make it safe for you. There is no universal safe level of cannabis use. Young people are especially at risk for developing health problems related to cannabis because your brain and your bodies are developing. Use of cannabinoids, THC, can impair your thinking and memory. Young adults especially need to be mindful about the motor skills that can be affected as it pertains to operating a motor vehicle and other accidents. Motor vehicle collisions and accidents are a number one contributor to adolescents' morbidity and mortality. And so while it may be that you think that THC is safe for you, it can result in serious harm through other accidents and injuries that you may not be anticipating. I remind adolescents that, again, their brain is really developing. And then I tell them, as I tell their parents, that they don't want to put themselves at risk for serious mental illness, including psychosis or schizophrenia, because these are serious mental illnesses that can affect one's life in the long term. I know that these diseases are not something that many adolescents are aware of, but I feel that if they were able to see or take care of people with schizophrenia, that risk would ring a little bit closer to home. And then I remind adolescents, as I've said, that vaping in particular has been associated with this vaping-associated lung injury, especially cannabis or THC-containing products, and that the oils are not the same as using herbal or leaf-based products. And then, of course, you know, it is somewhat rare, but I will tell you from personal experience that we care for people who have developed cannabis use disorder, and this can be a quite debilitating disorder for young people in their teenage years, in their 20s, and can really impact your ability to function in life, including be employed, finish school, all those things that are so important for adolescents and young adults to be really focused on. Yeah, I really want to highlight that South Shore Health is committed to improving the health of everyone, including adolescents in our community. We do have a Youth Health Connections program. This is a community benefits program at South Shore Health, and it is dedicated to developing the positive mental health and physical well-being of our young people across the region. And I encourage everybody to go to the South Shore Health website and look up the Youth Health Connections and work with organizations like Hingham Cares and others in this region to improve the health of our adolescents and communities.